Learning about your top 5 period symptoms Part 2. Yeast infection. Yeast infections are very common in women, particularly because yeast favors warm and moist areas. The telltale trait of discharge caused by a yeast infection is that it looks like cottage cheese, that is, white in color and thick in texture with clumps or lumps throughout the matter. In addition to this type of discharge, you may find that your vagina itches or burns. It may also have general soreness and pain that occurs during sex and especially when using the restroom. Yeast infection is often caused by several things. Yeast is already naturally present in the body, including the vagina, but sometimes the levels of yeast can be allowed to grow too much in comparison to the amount of good bacteria inside the house, that finishes up in associate in nursing passing yeast infection. The number of yeast can be increased the number of ways. Taking antibiotics can result in yeast infection if the number of good bacteria is not built back up before the yeast begins to flourish. Diabetes, wearing tight underwear when the weather is humid/hot, the use of vaginal douches, and the use of vaginal hygiene sprays or wipes can also increase one's chances of developing a yeast infection. A yeast infection can be treated in many different ways. One way is to use a non-prescription cream designed to treat mild yeast infection. You could also see a doctor get the prescription medication in either an oral or vaginal form. Exercising. It may sound a little unbelievable, but it's true that exercise can increase discharge before period and after. The typical discharge that most women experience is white in color and a bit watery in consistency. This discharge can occur at any time during a woman's cycle but can become increasingly noticeable after a long day of exercising or when one's physical activity level jumps up. Not to worry, this type of discharge is not serious and doesn't need to be treated. If it becomes bothersome, then simply wear a light pad or panty liner. Period symptoms, early menstrual period. Facts about early menstrual period. When a woman's cycle is interrupted by an early menstrual period, it can be very troubling. Having an irregular menstrual cycle is not all that unusual for some women, especially when approaching the age of menopause. When a woman reaches the age of about 45 to 55, it will become more common to have irregular cycles, but if the problem of having an early menstrual period continues, it can actually worsen. Understand the early menstrual period. When a woman is having a normal menstrual period, the cycle will be approximately 23 to 35 days between periods, counting from the first day of the last period until the first day of the next period. When someone has an early cycle, what happens is that they will begin their cycle before a full 23 days has elapsed. In most cases, the cause of the early menstrual period is due to the fact that an egg failed to mature, so it was not released during the menstrual cycle. Other types of early menstrual periods. There are really a number of different types of early menstrual periods. One type is known as polymenorrhea, which is an early menstrual period that occurs sooner than ever 21 days. Another type of irregular cycle is called oligomenorrhea. With this type of problem, a woman will have a period approximately every 35 days, but it will only last for a few days. In addition to these types of menstrual irregularities, there is also one known as amenorrhea. With this, a woman has stopped having periods at all for a period of 2 months or longer. It is normal for this to happen during pregnancy or breastfeeding, but it can affect other women as well. When approaching menopause, a woman can skip several periods before finally having one. The causes for an irregular menstrual period. One cause for having an abnormal early menstrual period is psychological. Although it is not too common for psychological problems to disrupt the normal period cycles, it can happen. Among the psychological problems that can cause problems with a woman's periods are anxiety, fatigue, and stress. When someone is under a lot of stress or anxiety, it can actually change the hormone levels in the body and cause someone to miss a period or start their cycle early. A physical problem that changes the hormone levels in the body will disrupt ovulation, which will cause an early menstrual period. Treatment for irregular or early menstrual period. Problems with a woman's cycles can be treated, and it is usually best to use a combination of treatments to return the cycles to normal. One of the first things a woman should do if she is having an early menstrual period or an irregular cycle is to change her lifestyle. Relieving stress and anxiety is important, as well as getting regular exercise. It may also be necessary to see an OB-GYN to start treatment. This will likely consist of hormone replacement therapy to balance the hormones. The biggest problem with hormone replacement therapy is that it can actually cause several side effects, and some of them are even worse than having an early menstrual period. To avoid the side effects of hormone replacement therapy, there are some natural remedies that can help to promote regular periods. Herbal medicines such as black cohosh can help regulate a woman's period. If you are having problems with having an early menstrual period, you may want to try some of the natural remedies. If these do not work, it is important to talk with your doctor and get a diagnosis and treatment plan. Period symptoms, spotting after period. Things to know when it comes to spotting after period. Although most women experience spotting after a period at some point in their lives, it can still be concerning. For the most part, it is completely normal and is not an indication that anything is seriously wrong. However, there are a few instances when it should be taken seriously, and knowing the red flags can help keep you safe and healthy. While some women start their periods at the age of 11 or even younger, most women do not start having regular periods until they are in their 20s. They might go for months, or even years, with regular periods, and then notice a gradual change. Their cycles might become slightly shorter, or even slightly longer, and the blood flow might increase or decrease. This is all pretty normal. However, sometimes spotting after period can be a sign that there is something wrong. Most of the time, the spotting that occurs after a period has ended is a small amount that might only be noticeable when the woman wipes. The blood tends to be a darkish brown in color. This is an indication that the uterus is letting out old blood that for some reason it didn't get rid of during the regular period. If this only happens for a couple of days and the amount is small, then there is typically no cause for concern. However, if it happens every month and the amount is enough to warrant wearing a sanitary napkin or tampon, then a visit should be made to the doctor to find out why the uterus isn't getting rid of all of the blood at once. If the spotting after a period is bright red in color, then the blood is fresh and is not old blood left over in the uterus. This should definitely be checked out by the doctor. Occasionally, spotting can be caused by a uterine cyst or an ovarian cyst. If you notice any sharp pain in your pelvic region that accompanies the spotting, this can be a sign of the cysts as well. Cysts can typically be seen on transvaginal ultrasound. Spotting after period can also be caused by adenomyosis, endometriosis, and some type of birth control pills. If you find that you are experiencing an unusually large amount of spotting after your periods, then you should definitely contact your healthcare provider. Although spotting can be harmless, it can also be a sign of a condition that can easily be treated. If nothing else, it can help set your mind at ease. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.